Welcome back. This is Whiteboard Wednesdays. I'm Dr. Drew. We're here at Forza Chiropractic, and today we're talking about scoliosis. So scoliosis is very prominent that we see in our office, specifically because of the fact that we are called a CBP office. So CBP stands for Chiropractic Biophysics, and so it's a technique that not only fixes pain, but also fixes the structure, which is an equal function. So in our office, we have state-of-the-art digital hospital-grade x-rays, which we're able to take from the front and from the side to analyze if you have some sort of curvature in the spine, whether that's pre-scoliosis, scoliosis, or mature scoliosis. In our office, we are the prime providers and correctors of that scoliosis. So let's review on the whiteboard today a little bit about scoliosis and the varying degrees. So there's different degrees, 0 to 10, 10 to 20, 20 to 40, and then 40 up. What we want to do is we want to catch you in an average curve of 0 to 10, which is pretty common if you're a corporate worker sitting all day, leaning to the side, or a lot of times we see postpartum moms after the pelvis has come back, they have a curvature of the spine because the hips aren't level. As we start to get further and further into that curvature, it just takes more time and more energy to correct that scoliosis. So in our office, once we adjust that spine, we also do chiropractic soft tissue work from physical therapy and mobility. And then we use a tool called a ScoliRoll, which is a wedge pillow that we actually have you lay on the side of the curve. And what it does is it's going to tabletop you to flatten that curve. So we start off at 5 minutes and we build our way all the way up. So scoliosis is something that you can check in your kids. If you have them take their shirt off, you stand from behind, you just have them bend over. You'll be able to see if that spine is straight or if there's some sort of curve. Also, another easy way to be able to check is if you're actually looking yourself in the mirror and you notice that one shoulder is dipped to one side or even one hip. Very common as well, concern that when runners come in with the amount of running, they can also feel that their gait is off or their running form is off too. But it's a very common issue that we see predominantly in females versus men. And specifically, we analyze that scoliosis degree of a curve by what they call a Cobb angle. So that's what I'm going to show you guys now. So this is a recent patient with us, and this is what we call an ADP lumbar spine image. So this is the top of his right, this is the top of the left. What you're going to notice is that we draw a straight vertical line from the center of the hips all the way up. Now it should be nice and straight. So when we draw a Cobb angle, what you're going to see is we're going to go from one peak of the curve from here to here, and then from the base from here to here. And you're going to see how the computer is going to trace through those dots. So we have a 21.2 degree curve to this left side because this is his left hip. So once we adjust that spine, now you're going to see here's the top of the rib, here's that pelvis. We're going to put that wedge pillow in between here and have him tabletop, and then use gravity as a force to naturally restore that structure. Once we restore that structure, now he's going to have a nice vertical spine, pelvis level, so all that weight's going to be equally divided through and then divided in the hips. Stay tuned for our post films on this patient. If you have any questions or concerns or comments, leave them below. We'll see you guys soon.